I passed the ACJ.
I know. Congratulations. No, it's good. You beat me to it.
Yeah, I beat you to it.
Okay, you beat me to it. No problem.
Yeah.
Well, congratulations on the results for our last week.
Thank you.
How do you feel?
Happy.
So happy. You were happier last week?
No, actually, you know what? Like last week, I was so shocked. I didn't believe I had passed. I had to check multiple times, as you guys know.
Yeah.
I kept checking.
Just
I was
to
like,
make sure it's real.
Is this real? Is this actually happening? I just didn't expect to pass on my first attempt, but I did.
Good. It's good. I'm really happy for you. And
right? It's a sunglasses moment.
It is. Yeah. It deserves it. We did try to record something last week, but then we had a little technical issue. It failed.
But it's good because last week it was still like I was still processing. Yeah.
Yes. The thing. You could keep the sunglasses.
Why?
It's okay.
Is there something wrong? No, I'm self-conscious for my eyes. I'm just kidding.
Well, again, really impressive. Congratulations.
Thank you.
How would you say your experience with the ACJ exam in general was? Like for people that are just starting, going into the ACJ, your experience with the exam?
The exam was, when I left, I felt like I had just done another mock, but it was a little bit easier than your mocks.
Okay.
So it was good, but I was also like, did I miss something? You know, because you start like doubting yourself. Like it seemed like easier than I was expecting. So
it's too easy.
I didn't know if I had passed or if I don't
want to say too easy, but like it feels like
it felt easier,
simple. Let's say, and like the cases came straightforward.
More like straightforward. Yeah. And then, but when that happens, I guess we start second guessing ourselves, right?
Mm-hmm.
Did I not pay attention to the questions? Like, did I miss this or that? So that's why I was so surprised, I guess, that I passed.
That's probably like the most common, one of the most issues that people have is like when it is simple and they put the answer, they're like, oh, there has to be more to answer. There has to be another thing that can't just be like that. And sometimes it just is like that.
Just is, yeah. And I guess that's what I learned throughout the course, like to not overthink the questions, to not like trying to find the trick. It's just focus while you're reading and you'll find the answer.
Don't over-answer an ACJ.
Don't over-answer, that's right.
All right.
And it worked out. And I did, like, when I was doing the exam, I had terrible back pain.
Yes.
I mentioned this last week.
I remember you were in the hospital. I can't recall but one of the AFK sessions you were in the hospital.
I did.
It's not like a funny story.
My boss made me do a session.
You decided to attend.
I'm just kidding. Yeah. I wanted to attend because first it was pharma. I love pharma. And in the hospital, we wait for a long time. So I'm like, why not? I'll just join.
Just to clarify, you attended as an instructor, one of the AFK lives.
Yes.
While you're at the hospital. That's how much you love pharma.
Yeah. But I was in a hospital because I had the back pain. I didn't know what it was. And it turned out to be kidney stones. So I went to the exam with horrible, horrible pain.
Oh, wow. So wait, that was the hospitalization was before the exam or after?
Right after, like days after the exam.
Okay, so you went to the exam with pain.
Yes.
Oh, wow. Okay, then I
thought it was like spine, like issues. Like I went to a chiropractor before the exam. I took like, anti-inflammatories, ibuprofen.
Oh, and they say like it's that kind of pain is like one of the most.
Is it 3,200? It's not. Actually, here it's 24. In Brazil, it's 32. Did you know that?
Yeah, I know. Like there's differences.
Okay, we're not getting into that. But yeah, it's curious. That's like I had to learn for AFK here.
Yeah,
and
there's
ACJ.
Some differences between different countries and the max daily doses.
But I did take 32.
But
anyways, you can cut that off. Anyways.
We're not cutting, too late now.
Oh, no. Okay.
But so you went to the exam with that pain. And they say like that's like some of the most severe pain. So did it feel that way or did it get worse?
No, it was progressing to that. Like during the exam, it was really bad. Like, is this too much information? Like after I left the exam, I felt sick, you know, like all that. Yeah. But I came home and then I was like, okay, I think this is like maybe more than just back pain. So I went to the hospital.
Well, I'm glad you're okay now. And I mean, it's an example of like actually no excuses, I guess. You still did it.
You have to go and do it, right?
Wow, yeah. And you were able to focus still.
And I was able to focus. That's good, right? Because during the mocks in the course, I feel like the worst mistake was like losing focus, like halfway through a question or halfway through the exam, I guess, like through the mock. Like if you lose your focus a little bit, you're gonna miss questions.
Yeah,
it's like super important.
Questions.
Yeah, like you're gonna miss not just marks, but like you may answer regarding a different tooth, right? Like those things. Like if you don't pay attention to what.
Especially in radiology, sometimes like you might see a lesion somewhere, but they're pointing the arrow to a different thing.
Yeah, and you just see the lesion, or like, okay, here.
Yeah.
Dentures cyst or something, and it's not. Like, it's about something else.
Or sometimes in endo, they could ask like, oh, what's on tooth 1-1? But you're looking at another endo tooth that has a problem.
Yeah. Sometimes,
like, You have to focus on reading the question, what they're actually asking about. So what kind of tips from your experience now, since you've done the ACJ, and of course, before the results come out, you're always like in this mode of, I don't know if I did enough. I don't know if I passed. And then when you pass, you're like, hey, I did it. What would be some tips to give people for the ACJ preparation?
To trust the process, to not over answer, to make sure you're staying focused during exam or practice cases or mocks, and just power through if you're in pain. If anything happens, just power through. Like you can do it.
And do you think like 3 months is enough for, let's say, majority of people, or some? Because we do notice, obviously, some people need more time sometimes. But do you think 3 months? Did you study first of all for 3 months straight, or did you enter late?
I feel like because I've always been in contact with AFK, so I've always been studying since I finished the exam. I don't feel like I only studied for 3 months. So I feel like I did get a little bit extra, because I just kept studying. So it might not be enough for everyone, but in general, I feel like it's a simpler exam than the AFK. So it can be enough. Like 3 months can be enough. It's a more relaxed exam. It's fun. It's
fun to study.
It's fun to study.
Yeah.
It's fun to take the exam. Like I always say that I sound like such a nerd. I love taking tests, and this was like one of the funnest ones, despite of the pain. I swear, it's just like fun. It's like different. Right?
I agree. Like looking at cases and trying to solve them, it gives you like this. And also, you were saying like I forgot where I wanted to go with that, but no problem.
Good.
It's okay.
Yeah, it happens. ADHD. but, so I'll say something. After AFK, because like it's just like text, this feels like, oh wow, like breath of fresh air, like some images, something, like something different.
It's like a fun practice. You're practicing. You actually feel like you're practicing.
Yeah.
Oh, I think, so what I wanted to say was like, it depends on where you start also with your judgment level.
Yeah.
Because sometimes it's like you're trying to correct these habits, right? And then some people could adapt to new habits faster than others. So it's like, can you prevent yourself from over answering? And I find that some, even though we're telling them that, we're instructing them, they still keep doing it over time. And it's like, how do you kick this habit out of you of trying to perfect the answers or something?
I was so worried about this because when I started the ACJ course, we got a practice. Was it 1 or 2? Like
I think I start you with an introduction case, just before you learn anything, just to see what you would do.
Let's see what you would do, like how you would do. And I was very confident with my knowledge, but I ended up like embarrassing myself a little bit live. Again, the boss made me do it. I'm just kidding. No, I volunteered myself to do it because I thought I was just confident, right?
It's good learning. You learned from it. Probably.
It was great. Look, I love embarrassing myself. Let me explain. Like that's when I learned best. Like because you embarrass yourself for like, oh wow, like I need to analyze myself. Like what did I do here wrong? And I did score like 55%. So I was like, oh wow, like
55. Yeah,
55.
Yeah. So, instead of saying maybe like you like to participate and take the risk.
I do.
Which is good. It's good to participate.
Yeah, in other words, I do like to participate and
take the risk, and you might be wrong, right? And embarrass yourself. But so and you learn from that. Like I think one of the things that people go through in the beginning is like they answer based on why not,
Yeah.
And just answer a lot versus like, no, this is a treatment for this. So you pick it, but don't pick just why not things like, oh, why not this and why not that?
Yeah.
Because some of the options are actually a negative one and you lose the question, right?
Yeah.
That's the thing where you want to fix. When you have 15 options, it's hard for people to go, oh, there's only one or two, you know, like they want to answer like 7.
Yeah. And then also, I was like so confused with the templates. Like there are the templates. And I remember in one live session, I looked at a picture. I was like, what do you guys think this is? I was like, oral submucous fibrosis. It's not even in the template, you know? I was like, no, but this looks like it. And Dr. Abnik, I think she was like, we have to stick to the template, you know? Like, so I was so confused. But thankfully I was able to learn and rewire and my brain, like, you know, oh, this is a different exam.
Yeah, you're trying to like, well, it's good to try both. Like we stick to the template where you master it, and then you never know, they could bring things out of the template.
They could,
And then they bring you that option if they want to, and then it's kind of like a clue a little bit that if they bring you a new option, it might be it.
Yeah.
But yeah, it's good that you're remembering Legion from AFK and you're trying to. So one question I get is like, what is transferable for people that are doing our AFK? They ask me, okay, I'm entering ACJ new, you know, they might still not have the book and they're saying, what's transferable from AFK to ACJ? What should I go review? If I don't have my ACJ book yet, what should I review from AFK? So you could go and then I could also share.
Okay, I think perio classification, the first one I can think of. Endo diagnosis. What else? Pathology is different, right? Because AFK, it's a lot of text, and in ACJ, we just practice with images, right? A lot of images. So it is a little bit different, but it's good to know. Like, it's good to review that. If you don't have the ACJ books, it's good to review, like, right? And I don't know, what else? What do you think?
I was going to say pharma as well. Like, not all pharma, because that's extensive, but like learning the antibiotics and NLG6 protocols. Yeah. The clinical like algorithms, what to prescribe. And mainly, the maximum doses will always be good to know. Like, that's for sure going to be something you have to memorize in ACJ as well. So if that's something you want to study, transfer to ACJ, you could start with that. And diagnosis of endo and perio. Path, I would say just images, but it's going to be difficult for them to filter that out from AFK because they might just go extensive into the histology and just read all the things about it, right? But yeah, and then anything else you would say?
Pharma, like interactions, drug interactions.
Some drug interactions, I would say. But then it's hard for them to find that one, like to summarize that maybe from AFK on. But they could, like that helps. Maybe for the NLG6 and antibiotics, obviously. Yeah. That's transferable. We're still waiting on the,
patient management, like medical emergencies.
Yes, that's exactly transferable almost, right? Like from, at least from our AFK course, if you know the management of those. Yeah.
A lot then.
That's a good one.
Right?
Yeah.
I mean,
if you look at the AFK books, it's like still
ortho
and
like the
diagnosis,
like
the clinical diagnosis, like Ceph,
like angle classification, the appliances, what they're used for,
could be like so
like if you want to study with the AFK books, you can.
I just don't want them to dive too deep into it.
Don't. I mean, but they're just getting out of AFK, like they must be good, right?
Yeah, they could.
Yeah.
Well, and I think, what are we at?
So, what?
Well,
that's
I think
good enough,
that's good. Yeah. Okay.
All right, so how do we wrap it up? Because now
let's just wrap it up. All right. Congratulations again.
Oh, thank you.
So your plan between Western and NDECC, maybe another time we'll talk about that.
We'll talk about that.
Figure that out, process it.
Yeah.
All right. Thank you.